Speaking of mental health here, on top of all those things, a new national hotline for mental health emergencies is launching in July. So instead of calling 911, you're going to be calling 988 if you're in some sort of mental health crisis. If you recall, federal regulators voted on this number a couple of years ago. And so basically it would mean that 988 would direct a caller to a suicide prevention hotline. Currently, that national suicide prevention line uses a 10-digit number, which routes calls to about 170 crisis centers. But each region has its own call center. However, some advocates worry that they're not going to be ready for the explosion of calls they expect when the line launches in mid-July.
Concern is that the youth won't wait to be transferred, or that someone who's done something to end their life, like taking the pills, that they would die because we can't get them routed to the emergency services that they need.
Right now, we know only 20 states, including Missouri and Illinois, have passed funding for the new line, so it is good that it's available here. The federal law leaves it up to each state to come up with their own legislation. So I want to show you here, if you do have to dial 988 in Missouri when this line opens, know that there is a coverage map of who's going to be answering your phone calls, and you can see it here. It's basically going to be covered by about 6 organizations. The state also has a 988 task force, making sure that every single county is covered. In St. Louis, we should mention, that is the behavioral health response. So those are in the greens, who's going to be responding to your phone calls. Right now, if you need them, you can call their 24-hour crisis support line via their 10-digit number. But starting July 16th, all you're going to have to do is dial 988.